Hello again. Now, there are calls for government to allow general practitioners to start administering COVID-19 vaccinations. It's believed this will make the process more convenient and help accelerate uptake. Well, let's discuss this further now with Dr. Angelique Coetzee from the South African Medical Association. Dr. Coetzee, good afternoon. Thank you very much for joining us here this afternoon on ENCA. I guess, GPs, most of us, those who can afford, do have access to GPs. GPs have those good relations, supposedly, with their patients, so there'll be an easy way in terms of convincing patients to take the jab, and they could assist the vaccination rollout. Is that the basis of your call, as SAMA?
Yes, good afternoon, and I hope to all, my wish to all viewers out there and ENCA is let us have a great 2022. If you look at what is happening currently, these the vaccines are not being taken to the people out there. Mass vaccinations, I think we have been seen that it did play a huge role, but currently mass vaccination is not the answer. So if you look at what is happening in other countries, it's normally the GPs that is administering these vaccines. We have been administering vaccines for forever, since we've been qualified. So if we really want to get to the people who's still unvaccinated, we would need, however, to start to bring in the general family practitioners out there.
How would it work? How would it work, Dr. Coetzee, with that? I mean, you quite correctly, we saw the Vuma vaccination campaigns which have worked, those mass campaigns, but how would the GP one work? I mean, government currently is seemingly battling to get the numbers up.
Yes, they are battling. So first of all, the EVDS platform where the GPs needs to register needs to be sorted. We are saying that up until now, for the GPs to register on that platform, we call it point zero. Point zero is where you start, right from the beginning, that first point that you try to enter. It's not GP friendly. It doesn't speak to the GPs. So the biggest problem is lying with point zero. We cannot access the EVDS system. It is extremely difficult. The questions are not related to general family practitioners. We have been told that, for now, it's more prudent to get the pharmacists and the big hospital groups on board. But right from the start, we have said you need to bring the GPs on board. So if I look at these two problems, first, point zero on the EVDS system that needs urgently to be addressed, because if you want to go forward with NHI and you can't even get the GPs to register their practices on that system, then you are in for a big surprise for NHI. The second thing is that is also important is to make it easier for these family practitioners or GPs that would like to administer these vaccines. For now, you can only buy in bulk. Bulk is extremely 600,000 Rand. You cannot afford that. We cannot afford that. And it should be, we need to have depots. Depots where we can order 10 jabs or 15 jabs as you need for your surgery on a daily basis. And then make sure that you administer those vaccines.
Dr. Coetzee, just on these two problems you've identified, logistically then this might become a huge challenge for government. While what you are saying, you are calling for the involvement of general family practitioners in the vaccination of COVID-19, the COVID-19 jabs, it makes sense. It's practically, from what you've just said, how feasible would it be?
Well, you will get definitely more or a better uptake with your vaccines. But the logistics around it, it's extremely complicated. Now, why can other countries get it right? Why is it so difficult in South Africa to get it right?
Have you got possible solutions?
Yeah, exactly what I've said. They need to make sure that the EVDS system becomes GP friendly for us to register. They need to make sure that there's a depot system where we can, even if we get that depot system directly from National Department of Health or Provincial Department of Health, that would help and assist.
Okay, so those two, are they the only challenges?
No. The next challenge, they are still struggling to get paid. The private sector pharmacies, there's the last, that was now before New Year started, there was problems with the funding, around the funding. And so again, if I look at that, then I am glad that we are not yet into that, because we would have now sit with that same problems. So they need to sort the logistics around it. It can't be that difficult.
No, I hear.
I
think you are making sense in terms of the uptakes, to improve the uptake of vaccination by involving general family practitioners. After all, other countries are doing it, but we've got these logistical challenges, which you have so eloquently identified as some that need to be sorted out. Thanks for your time this afternoon, Dr. Angelique Coetzee, and of course speaking to us about the calls for government to allow general family practitioners to administer COVID-19 vaccine in order to help accelerate uptake.